About 18 months ago, we decided to, well, we've run as a team for some 3 or 4 years, and those of you who know me will know I've been doing this kind of work here for about 20 years. But we came up with this grouping which describes the overall different types of contributions that we make as a team to the National Aspergillosis Centre. There are 3 or 4 of us, and we're essentially 2 of us are scientists, scientific background, which is myself and Beth, and Lauren has more of a social media and actually worked properly in the NHS as a proper clinician. So we got quite contrasting and skills, and we think they go together quite well. So I just thought I'd just describe to you what the NAC Cares team does, essentially what the 3 or 4 of us do. We've got Chris Harris, essentially is also part of our team for lots of things that we do. And we currently have a student, Katie McGuinness, working with us for a year as well from the university. So as this has been a long day, and if you remember right back to the start, the National Aspergillosis Centre started in 2009. It was a highly specialised commission service from the NHS. So it's available to everyone in the UK, be they from Manchester or Inverness. You can come here to receive a benefit of our services if you are referred by a secondary level clinician, such as a respiratory consultant at that type of level. GPs occasionally refer to us, but we kind of try to discourage that. We are essentially a service that is, we're serving the hospital sector rather than the GP sector. Commissioners recognise that patients with chronic pulmonary aspergillosis were rare, a few hundred in the UK. So when it was set up, they recognised that patients and non-specialist clinical staff even needed support, as other patients and as other patients with aspergillosis. The chronic forms of aspergillosis are very rare in the UK, and also the expertise to treat those, diagnose and treat those people in the specialist medical care community were also quite rare. So they funded this position whereby we support in a whole different number of ways, which we found that the acronym CARES described and encompassed reasonably well. So CARES stands for Community, Awareness, Research, Education and Support. And that means both of the patient and carer community, the layperson community, and also the medical community in some instances, as well as the research community. We essentially build communities of patients to offer social and mutual support. And you've heard today how important that mutual social support is to our group of patients. So that was one of our original tasks, and one which I'll be telling you a bit more about in a second, about how well we're doing in that. We also, if there was a big problem that there wasn't enough awareness of aspergillosis in the UK, going back 12, 13 years, really. There are a lot of, the more people know about aspergillosis, the more chance that people will be diagnosed with aspergillosis and be sent to specialised care centres such as this one. So another one of our tasks was to build awareness of all forms of aspergillosis, but in particular the rare chronic forms, chronic pulmonary aspergillosis, CPA, and allergic bronchopulmonary aspergillosis, ABPA. Along the way, we've identified a number of other examples of where aspergillus, the fungus, impacts the health of people, but these are the main 2 areas that we concentrate on. We support a lot of that research you've just been hearing about by supporting patient involvement and encouraging patient involvement. Just like I've been discussing with Courtney from the ELF about encouraging you to go and join one of their PAGs, well, that sort of thing. And also locally here, and people in Manchester at MFIG, we can provide patient opinions, provide a little bit of patient time, get them to come into us to talk to our patients about what they're doing, a bit like we're doing today. But in the pre-COVID days, we used to do it face-to-face as well as online, but we've evolved to this much larger platform now, although we may well move back partly to face-to-face at some point in the future when it's deemed safe to do so. We also do a lot of educational work. We've always done a lot of educational resource work. So some of the people who've been here a while will remember the aspergillosis.org.uk website, which is still up and running, but this team currently don't have a role in managing. We have the aspergillosis.org website, which is the one that we take responsibility for, because that is the NHS website that we've been taken on to support and to build. So that is relevant to patients and carers, but also doctors and nurses, especially in the sort of GP and GP network area, can access and learn from. The communities we've made are quite big. There's Facebook's. We originally started off in a sort of much smaller scale, and moved to Facebook around the time that the centre started. And with the power of Facebook, there's around about a community of around about 3,000 people on Facebook that we support, as many of you will know, because that's how you learned about this meeting. Lauren does a lot of work in the social media area around Twitter, where we're a fairly rapidly growing Twitter community of 3,000 followers. Health Unlocked goes right back to at least 5 years, which was a private service that was hired by the NHS to support a sort of the more rarer illness areas, and that has built up over the years for aspergillosis, or in fact it's a serious fungal infection group to 3,600 members. We're not allowed to, clearly, obviously, we're not allowed to use things like Facebook and Twitter, because when we're working for the NHS, and we're dealing with private information. So we now have this Telegram service, which is not an old-fashioned Telegram service. Obviously, this is an app on your phone or on your computer, which you can use to communicate with us privately and securely if you are a patient of NAC. And currently about 40 patients use that. And Beth sends out our quarterly newsletter to about 6,000 assorted recipients, which will be everybody from consultants to patients. Offline, we keep in direct contact, or have been keeping in direct contact, with all of our patients that visit our clinics every week. There's about 60 visit the clinics here a week, and we text those people every week with various messages asking for feedback, amongst other things, on the performance of the centre. As I said, once the pandemic recedes, we will probably be able to go back to meeting patients face-to-face in clinic and passing on some of this information instead of just having to use phones. At the moment, very few people are still coming to clinic, although we do have a few. What do we talk to these communities about? All kinds of things associated with living with aspergillosis, signposting people to the appropriate resources that we've talked about, and many other types of resources there are around the world. Mostly we talk to patients and carers, but we do also have regular questions and answer sessions from clinical staff. And we are increasing that activity to involve GP level staff in the coming year. We put out regular articles to inform and support patients and carers with their health and well-being. People who attend our Friday meetings will know that we have regular conversations about this, all kinds of different aspects around health and well-being, to try and optimize the health and well-being of our patients, even though they're ill. As we was mentioned earlier, if you look after the person, then the health will improve regardless of their aspergillosis. Aspergillosis.org has been extensively used to support people with aspergillosis in this process. Also a lot of asthma. Throughout the COVID pandemic waves, we put a lot of work into clarifying government and NHS guidelines for our specific group of patients using those websites and the meetings that we were holding every day at one point 2 years ago. We also have a function that we link a lot of our patients and carers to our many researchers. We will do this for anyone that wants help. The research, and this improves the research they're doing, as Elaine will know, you really need the input from patients these days to mould your health projects, and this is what ALF are strongly involved in doing, and that they're very successful in doing it. It's a two-way interaction now. It's not just us helping you, it's you helping us. And a lot of what you give us is feedback also to help develop the next service, which I think I'll talk about in just a sec. We link patients and carers to advances in medical science that concern aspergillosis, just rather like we've done this afternoon. We get scientists to come and talk about their work. It gives us hope, it gives us perspective that there is lots of work going on to try and make your quality of life better in the near future. Yep, just talked about that. Some of the feedback we get, particularly around those clinic, directly involving our clinic and face-to-face in the clinic, is also a feedback route for those people to express that everything from their heartfelt thanks to the staff here and their approval of the NAC service, but also their suggestions of occasional dissatisfaction which we take on board with a view to improving any part of the service that a patient might not have felt we got quite right on the day. And that's a very important area of quality control for us and the staff here. This strengthens the NAC and constantly improves us. Okay, if you have aspergillosis in the UK, we are here to help wherever you are in the NHS. If you are lonely, if you are not doing so well, if you are part of a GP network that is struggling to understand your illness, if your respiratory doctor needs information to help decide whether or not to refer you, contact us. This is our email address. You can also contact us through Facebook groups and on the phone, which we which is on the MFT website, which I'll show you shortly, I think. I'll link with us. Over to you, Beth.
I'm Beth. I work in the CARES team, doing more medical writing and stuff with the lab and clinical side of things, more than the patient stuff. I'll be really quick, and it's mostly pictures anyway, so don't worry. So just to expand a little bit on what Graham was saying about, where's my show? Can you see my slides?
Yes.
Brilliant. Just to expand a little bit on what Graham was saying, that we also do a lot of training and educational resources for doctors in hospital doctors, GPs, and also other lab staff. So I'm just going to show you some fun pictures of some stuff we worked on. So as part of the awareness branch of what we do, we are quite active. We go out among places where lots of doctors congregate. So this picture, this is us at the big respiratory conference for Europe that happens once a year. And I mean, it's a colossal scale, like all the lung doctors and all the companies that make the medications and the devices, everybody's there. And you can see like all the different posters and all the different leaflets we've got. And just half a dozen of us sat on that stall and just talked to people about aspergillosis every day. And people were really interested. A lot of people took leaflets, visited the websites afterwards and signed up for our newsletter. So it was very much worth doing. Lauren does a lot on, a lot of doctors, they tend to use Twitter and LinkedIn are the social media platforms they would use professionally. So a lot of Lauren's content reaches them that way. And we also support, because obviously, like, doctors busy. When they've got research to do, we support that in some ways. Like, we've started helping people put together conference posters. So the poster that's got the pink bars on, that's the one that's going to be shown on Wednesday and Thursday this week at the Advances Against Aspergillosis conference by Lily, who you saw earlier. And we just kind of did a bit of help with that, just sort of doing the layout and all typesetting. And it means that we can get the message out about the work that we've done. We can get more of it out there because we're sort of doing a bit of support. So people like Lily can go back in the lab and leave the typesetting to us. And we're going to hopefully do more of that in the future. And we make like video content and shareable social media content so that people can promote their work, so that people can just know that the papers come out and see what we're doing. And also it's important so that other centres can see what we're doing and think, well, you know, there's this sort of best practice. Maybe these are things that we should consider doing. We also look after the website, which is one of the main ways that doctors might contact us. So there's the MFT website. So when the consultant wants to do a referral, they go on one of our websites and they can see the criteria and everything. And the lab website as well. So the mycology lab that all your samples get sent to, we look after their website, and it explains little bits about how does the test work and how should it be interpreted. And we've also got a training course for GPs that's going to be hopefully coming up as soon as possible through MIMS, which is it's a training platform. And that's something the clinical fellows have put together, and it explains about the different types of aspergillosis, and it's got a case study, and it just explains all the background and what a GP needs to know to look after any of their patients that have got aspergillosis, which is really good. And the photo on the right hand side, that's Katie McGuinness, that's our student for the year. We've got she's an undergraduate. We've got a year of her time, and we've got her making a new website. So the laboratory, they put a textbook out a few years ago with lots of different case studies of all different fungal diseases called by all different fungi. But we decided to reformat it. Instead of being a book, we decided to make it a bit more user-friendly and make it a website. And so we're converting that and updating everything and adding new cases. And so it's going to be a little virtual hospital. You can go in and you can go to the different wards. You could go to intensive care and find invasive aspergillosis cases, or any different, or dermatology and find some skin conditions. And so we're hoping that doctors, like consultants, GPs, and like nurse practitioners as well, maybe some lab staff, all across the NHS, we're hoping that they'll come and sign up to this website, and they'll have this as sort of a reference that they can go to, and they can make notes there and also see what we're up to, and just sort of know where to go for information if they need it. If there's any clinicians or lab staff watching who think this sounds really interesting, we're looking for a few guinea pigs to do a pilot study, because we want to make sure that the format that we're showing things in, we want to make sure it's really relevant to what people need and the sort of questions that doctors have, because obviously different specialties, different job titles, we want to make sure it's really relevant to everybody. So if there is anybody that would like to volunteer for that, you can email me at elizabeth.bradshaw2, it has to have the number 2 in, at mft.nhs.uk, or if you just drop me your email address in the chat or something. It'll take probably half an hour, maybe an extra half an hour if you're okay to do a Zoom chat as well. So one of the things we want to do with this is make it, so on the right hand side you can see this is one of the case studies. The pilot study is going to be CPA and another one for ABPA. And each one, we're going to make sure every single one, the patient in the case study, they're all fake, obviously, has a name and a photo and a quote from the patient explaining how it affects them as a person, how it affects their life, rather than just being a sort of dry, clinical, just medical stuff. We want to bring patients to the front of this, and make sure that sort of people are getting sent to our support groups as well as getting the tablets. So we're quite excited about that.